Subscribe to our YouTube channel and don't forget to press the bell icon to get all the latest updates. Much has been said about how Mumbai's hospitals are overstretched, overwhelmed, how patients are having to run from hospital to get a bed. And we've been reporting some of those stories. Private hospitals have now been requisitioned by government order. And at this moment, we're standing across the road from the SION Hospital, which is, of course, one of the key COVID hospitals of the city. But what about how the patients aside, the patients of course are running from hospital to hospital for beds, but what about the doctors themselves? What are some of the problems that they are facing? Let's speak to the resident doctors here at SION Hospital, and one of the things that's actually happening, and we're going to learn more from them, is that several of the doctors here at the front line of this battle are testing positive themselves. And you can at this moment, of course, if the camera just turns around that side, you can see ambulances in the distance. We are right outside the SION Hospital. And let me start with one of the doctors who did test positive, Dr. Gaurav. Tell us a little bit about when you tested positive and how long did you remain infected?
I was tested positive on 11th of May. Probably I got this infection while I was in work. It was not a very good experience. From the psychiatric point of view, I was the first resident. I didn't know what would happen to me. Physically I was fine. Physically I was doing well. Mentally it was challenging, but within few days I was asymptomatic. Within very short span of time I was asymptomatic. I got negative reports. I was 14 days quarantined, and then I was sent back to work.
And now you're already back at work.
Yeah, it's been a long time since I'm back at work.
But जो आपके साथ हुआ वो अब बहुत डॉक्टर्स के साथ हो रहा है, and at last count that number has crossed 60.
Sure, it's happening. It's rampant.
So rampant is the word for resident doctors who are testing positive, and that creates problems of its own, doesn't it, Dr. Avinash? We have Dr. Gaurav here who tested positive, was able to get quarantined for 14 days. But not all doctors are able to get that time off. What exactly is happening? And what are you going to do when an overstretched hospital system has so many doctors testing positive?
First of all, so many doctors getting positive, there are many reasons. One of them reason will be the maximum overburden hospital, overstretched extra working hours which are being given to us for the COVID, serving the COVID wards. Previously, according to the ICMR guidelines, it was mentioned that 7 days of work and 7 days of quarantine. But as the number of cases in Mumbai are increasing, and looking at the number of cases, BMC and government has to increase the number of beds to cater those patients. So for that, looking at the patient load and increasing number of cases of COVID-19, the BMC says that you work for 5 days and 2 days of quarantine. Then after the residents stood up for themselves, and they decided that this should not be done. Then the government came up with 9 days of work and 6 days of quarantine. But actually, when you are working in the COVID wards, and if with bad luck you got infected with the COVID, it takes at least 5 to 6 days to show the symptom and to test positive for the COVID. So indirectly, if you are being given the quarantine of less than 6 days, then it is something like we are the source of infection to other patient which we are going to treat in the future. So somewhere I feel like the policy which is being put up in for 9 days of work and 6 days of quarantine is going to increase the number of cases.
So you're actually saying it also makes the patients potentially vulnerable because you're treating the same patients. Now, Dr. Rushabh, you've been talking a lot about the overstrained hospitals, and we've been seeing patients, we've met them, run from hospital to try and get a bed. And you've been trying to explain कि अगर ये Italy और Spain में हो सकता है तो यहाँ क्यों नहीं होगा? So why exactly in Mumbai is there such a struggle for a bed?
As correctly quoted, that Italy and Spain, even these medical systems were overstretched. Now, what do we learn from their medical systems is that when we had a lockdown, that was the time for preparedness for beds as well as the medical facilities which were to be given to the patients. If a patient, I might say, I've read a news today itself when one of the doctors was finding for beds for 5 hours and in the end succumbed. I want to make a point is, why can't we have a live counter of available beds in the hospitals which are catering to COVID? Now that 80% of the beds in all the private hospitals have been taken up by the government itself, why not create a system? Yes, it's a learning time. Yes, government is doing a fantastic job. Yes, the government is battling on many fronts. But one of the fronts which is being completely criticized or being time and again criticized is being unable to show the number of number of beds which are available. Why the fuss for a patient to run from different hospitals at the time when there's inavailability of transport facility, at the time when the ambulance facility themselves are trying to shun off? Because it's a normal psychological phenomenon. If an ambulance person says that I might end up getting infected, it's fair on his part to avoid it. But then at the same time, we need to understand that this is not only an infective crisis, it's an humanitarian crisis.
Yeah. So how much more is the capacity, what is the mismatch between capacity, for example, at SION? Let me ask you that. What is the mismatch between capacity at SION and the beds you have?
Actually, if talking about only SION will be not a good...
okay, overall, what do you think?
Overall, looking at the number of cases being increased in the Mumbai day by day, being the epicenter of the COVID, definitely the number of beds going to be less as compared to the number of cases. But
what is that gap?
For example, take example of SION Hospital. We have total 400 beds for COVID positive patients, and for now there are only 310 patients. But whenever positive comes and there is vacancy for the dedicated COVID hospital, we transfer them.
Now, you've been talking about other problems like canteen food for the doctors, and at this point food is coming from Gurudwaras for resident doctors. Can you talk about that?
Yeah, we'll like to thank the Taj Tats, which has been providing unstopped food, lunch as well as dinner for last 55 days. Due to certain reasons, they've stopped coming from today itself. Now we face a problem is one of the canteen members has tested positive, because of which the panic ran through the members of the canteen and they've shunned. Now the crisis is SION Hospital, I'm just speaking on the front of SION Hospital, SION Hospital has only one canteen at present, which caters to somewhere around 1,000 people, which includes resident doctors, senior doctors, BMC officials, BMC people, and the relatives as well. Is it fair for the person in the canteen himself to be exposed to so many people? I agree to the point that density is large, but then when we have a facility, I think administration should take a step forward.
And where is food coming from right now?
We are getting food. We've just arranged for our food from ourselves, from a Gurudwara, because Gurudwara in Andheri. We like to thank the facility for providing us food. At the same time, I would ask the administration to take a step forward, treat us as their kids, try arranging for the facilities in our hostel itself.
One more question and then I'll come to you, Akshay. You have said that doctors who test positive, and remember, I just want to turn to Dr. Gaurav over here. Dr. Gaurav was the first resident doctor at SION to test positive, but since then, here Rushabh is telling us that number has crossed 60 at SION Hospital alone, and it's rampant. And you've been saying that those who test positive are being placed in the ward itself with other patients. Can you talk a little bit about that?
So initially the problem wasn't faced by the resident doctors, but as I completely agree that Mumbai is falling short on beds, Mumbai is facing acute shortage of beds, there has been rampant spread of corona in the community. But at the same time, if you cannot suffice to your resident doctors, it would create a question in the mind of general population. If they cannot take care of their kids, how would they take care of our kids?
So are you saying doctors are not getting beds either?
Yes, I mean one of the news articles which recently said that a doctor succumbed after 5 hours of journey. If he cannot get a bed, it's pretty obvious other doctors would fear. Again, this fear creeps in and their clinics start shutting.
And Akshay, there's been talk of a COVID incentive, but you all are a little upset about that as well.
Yeah, ma'am. Recently, we all got a stipend, and we faced the issue of 10% stipend cut. So after that, meetings were done, and authorities have assured us that there will be a hike, but we are not sure about it. So if it is if they decide it and if they give us, then definitely it will be a welcome move.
You wanted to add to that?
Yeah, previously when it was started, initially BMC came with the option that the hazard allowance will be given to all the residents and all the healthcare workers which are working currently at the government hospitals. Then it was decided that 300 per day allowance will be given, but not a single resident in Mumbai has got the allowance. Second thing, we had one meeting with the higher authorities regarding the stipend hike, and they told us to put it on the paper and give us, we will do something about it. Then we put up the hike of around 25,000, and which was supposed to get given to us by in August 2018, but it is not yet given. Then after so many to and fro from the offices and visiting doing meeting with many of the authorities, they said okay, we will give you 10k hike. As we said okay, करते हैं. Lekin after that they to bring a new circular, they're saying that the 10k hike will be given, but it will be limited to only COVID period. So somewhere
so you feel demoralized?
Yeah, we are feeling demoralized. And second thing, it is like they are taking our problems as a routine hai in loka. What to do that?
Taking for granted. Last comment. You were saying if there can be one nation, one ration card, why aren't resident doctors all over India being paid the same?
Yes, I mean it is a brainchild of our PM himself when he instituted one nation, one pension for the army officer, one nation, one ration card for the poor. We see a stipend decrease goes from north to south when a resident doctor in Delhi is paid 1,20,000. Resident doctor in Maharashtra is getting paid 59,000. Resident doctor in Tamil Nadu is getting 40,000. Yes, I agree, it's not a central issue. Yes, it is taken care by the state governments. But then why not an idea being proposed that a resident doctor in Delhi or Maharashtra is catering to the same number of patients, is catering to the same number of surgeries, is being the workhorse of the public health system. Why not cater to an idea of one nation, one resident policy, one nation, one resident stipend?
And at this point, it has become even more crucial because let's remind you, as we talk about doctors testing positive, more than 60 at SION itself, the fact of the matter is that it is young 20-something doctors who are at the front line of this battle, and in public hospitals like SION, they will continue to cater to the poorest patients. The poorest patients will continue to come here despite the requisitioning of private hospitals, despite the capping of fees, because even with the capped fees, that is something maybe the middle class can afford, but the poorest Indian will still have to come to hospitals like the SION Hospital, so they should not have to be negotiating for their salaries, for their incentives, and for their food, for their PPE kits, for their time off, for their quarantine. And we have to remember that as of this evening, more than 60 of them have tested positive, and that's going to throw up a new challenge. Soon you might be looking at a shortage of doctors, and then the question must be asked, what will you do at that point?